watching CBSN Denver. Thanks for being with us. I'm Karen Lee. It's already time to start thinking about, flu season. With COVID cases once again increasing, doctors are worried that hospitals could be overwhelmed by both flu and COVID cases. That's why they are hoping that you will get your flu shot. Dr. Scott Joy is the Chief Medical Officer for the Health One Physician Services Group. Dr. Joy, when is the best time, of course, to get the flu vaccine, and who is eligible for the shot right now?
So I think the best time to get the vaccine, Karen, is probably in October, mid to late October. The reason why that's important is there's really a 5 to 6 month coverage with the influenza vaccine. So you don't want to get it too early because you may get a late peaking flu season in February and March. And if you get the vaccine in, August and September, it actually might wane the immunity as it gets into early springtime when we still might have some flu around.
Yeah, I know. I was taking my daughter to the doctor the other day, and they said, hey, you want to get your flu shot? We know that they're already in, which is good news. Really good news.
They are.
All right. Doctor, also, people have already started getting their COVID booster shots. So can you get that at the same time as you get the flu vaccine? And do you recommend that?
Yeah, currently we are, the CDC recommends that you are able to get the COVID vaccine along with the influenza vaccine. I think we're still working out a lot of the logistics and the right patient population for the boosters. So I think that will continue to develop over the fall. But there is no scientific evidence to say it is not a good idea to get both of them together. Actually, from a convenience standpoint and really working to optimize our infection prevention, makes a lot of sense to get them together so you're covered for the rest of the season.
Yeah, that would be great. With flu and COVID circulating, we know at the same time it always does. Many people may, of course, have a hard time knowing which virus they have. Symptoms of flu and COVID are a little different, though, right? There are some things that maybe you could pay attention to.
Yeah, I think that's a great question. I think the thing that we've seen with COVID over the last year and a half is the loss of taste and smell, to be very specific to the coronavirus. So I think that's a lot different, and we don't see that reported with the influenza virus and most common upper respiratory infections. So the loss of taste and smell is very important. I will say it's been very interesting recently to clinically see some patients who have tested positive for COVID have more GI symptoms, some nausea, some vomiting, and diarrhea. That's a little bit different than what we've seen earlier in the pandemic.
Yeah, earlier on it was more the headaches and fever, wasn't it? That seemed to show up a lot.
Exactly. And we're seeing a little bit more of an increase in GI symptoms in patients reporting to us who are testing positive for COVID, particularly with the Delta variant being around.
Yeah, as it changes, right? Flu activity, we know last year was at a record low. That's, of course, thanks to more people getting the vaccine, as well as all the mask wearing, the washing hands, social distancing. What do you think the prediction will be for this year as we start to mingle a little bit more?
Yeah, I think a great question. I think we rely on some of the data going on in the Southern Hemisphere when we look at what's happening in Australia. And the number of flu cases this year are lower than the 5-year average. Now, the Southern Hemisphere has been a little more strict about the restrictions and interactions, but we're hoping that some of the good infection control behaviors that we've recommended over the last year and a half, we call them the 3 W's, washing your hands, wearing your mask, watching your distance. I think in a way it's become a little bit part of our lives moving forward. So we're hoping that we'll have lower influenza cases as well. And still an awesome reason to continue to get the flu shot every year. The flu vaccine, I like to tell my patients, is just kind of giving a little bit of an exercise routine for your immune system. The more you kind of get the flu vaccine, the more it strengthens your immune system. And there was a study in the mid-90s that showed patients who got the influenza vaccine had 25% fewer other viruses throughout the season. So not only does it protect you against the influenza virus, but it also looks like it can help reduce the risk of those other pesky upper respiratory viruses that we tend to get in the fall and winter season.
Well, that's great information. More reason to get it for sure. And hopefully all this hand washing and these good measures we're taking will pay off this year. Dr. Joy, thank you so much for being with us and providing all that information. We appreciate your time. Thanks so much.
Thank you, Karen.
And of course, for the latest headlines, stay with us right here on CBSN Denver.